Okay, great. So good evening and sorry for some delay and disturbance. So Dr. Raju, Tejas, we are already live on Facebook and our viewers are waiting for the discussion to start. So today we have this open panel discussion. So I request my viewers and all the people who are watching this streaming live that please ask your questions. You can join us on Zoom, or if you are on Facebook, you can type your questions on this video box below. And we will try to answer all the questions, whatever are there related to diabetes and COVID 19, whatever is happening right now. Right? So, to start with, I have some questions for Tejas. Like already few people have given their questions. So Tejas, we will start with you. That one person was telling me when I discussed that, when I told them that we have this particular session. So he was like, as I do home activities, still pre and post workout meals are important, being a diabetic. So what do you feel?
Yes, absolutely. Uh, Pre and post workout meals are important, and equally you have to check your sugar levels, ideally before exercise and after exercise also if possible. But don't miss
Okay.
your exercise checkup, because if you are already low, then it is not recommended to exercise. And if you're already very high on your sugar levels, then also it is recommended that you take necessary measures first and then start exercising. So you have to be sure before you start exercising that your sugars are good. And along with that, as you said, pre-workout and post-workout meals are equally important. And pre-workout meal should be such that it shouldn't be very heavy. It should be taken actually half an hour before workout, and should be a combination of carbohydrates and proteins. That too, complex
Right.
carbohydrates and proteins. So what I suggest usually before going for a workout, if it is morning time for people, actually most of the people work out in the morning, early in the morning, once they wake
Right.
up. So
Right.
I suggest them to have a small piece of fruit or maybe a small fruit, and along with that a few nuts or half a cup of milk or half a cube of cheese. If they could have that, that gives them perfect combination of complex carbohydrates as well as proteins, and that's not very much in quantity, so they won't feel full while exercising. They can exercise well. At the same time, they can maintain their sugars well. Post workout, it is important to have good amount of fluids, because you lose quite a lot of amount of fluids through your body while you work out through sweat. So it is important to have sips of fluid during workout, but after workout also I suggest that
Okay.
have at least a glass of water or 250 ml of water. And if you could add some vitamin C to it, like half a lime, or if you could have some orange juice. For diabetic people, I don't recommend juice, but then they can have a whole orange instead of that. So
Yes.
whole orange, or maybe if amla is there, some amla juice in water. So some
Yeah.
vitamin C after workout, and then they can proceed with their next meal. It is not that they should have very heavy post-workout meal as well, but if the next meal is there, like if their breakfast is already there after their workout, then they can go ahead with their breakfast. But also make sure that your sugars are good, and then decide what to eat and when to eat.
Yes. Thank you so much. I mean, this is pretty much self-explanatory answer. So one more question related to this. So can we say that if the person is diabetic, whether type 1 or type 2, he should work out in the evening because he is not empty stomach. Like, he had his breakfast, then he had his lunch. Then is it better to do his regular workout in the evening time? Can we say that, or no, not necessary?
So I don't think so. If the person is managing sugars well, if it is type 1 diabetic person, and if he is managing his sugars on basal bolus insulin, then he can always, have his bolus insulin later, like after workout. And on basal insulin, having a good amount of workout is not an issue at all. So I don't think that it's time restriction for people with diabetes as far as their workout is concerned. They can have their workout anytime. But if a person has specific blood sugar trends at particular time, that suppose a person always has hypos in the morning, then it is
Right.
to avoid workout at that particular time. But if it is not so, then I don't think time is an issue for exercise.
Right. So very well said, Tejas. So we can say during this home quarantine period, whether we work out in the morning or in the evening, whether we are doing just spot jogging or whether we are doing Surya Namaskar or yoga, we need to make sure that we are checking our blood sugar levels before starting the activity. Right?
And
Great.
one more point, that if a person with diabetes is elderly or has age more than around 40 or 50, and if he cannot sustain long hours of exercise at a stretch, then it is better to break it up into 2 sessions or 3 sessions throughout.
Okay.
So half an hour in the morning, half an hour in the evening, or maybe 15 minutes in the morning, 15 minutes in the evening, match up to the recommendations. That also can be done.
Absolutely, that's a great input, I would say, and we can definitely implement this. Ki split out your overall workout in two sets, right? So I request Dr. Anju also, if you can switch on your video. I have one question for you. So Dr. Anju, am I audible to you? Dr. Anju, am I audible to you? I think there is some connectivity issue. I will, till then Dr. Anju is coming live, I will take one more question, which is for diet or which is for Tejas again. One thing that in today's time during this corona pandemic is going on overall, not only for diabetic people, they are saying ki having lukewarm water or having, hot drinks is helping you. So how you would like to comment on this ki how it will help a diabetic person ki having lukewarm water throughout the day, because it's hot now, temperature is rising, it's a bit difficult.
Yeah, it is said that hot fluids are good for keeping COVID away. But I don't think it is scientifically proven. I have not come across any scientific literature as such which describes that if you keep on sipping or drinking hot fluid throughout the day, you are likely to keep COVID away. So I don't think there is very much authenticity to this statement. But I think there is no harm in drinking hot water,
Okay.
especially if you are not adding any sweet things to it, like sugar, jaggery. Some people are sipping on tea and coffee throughout the day, thinking that it will
Right.
help, but it's not going to help them at all. Rather, it can harm them. So if you are going to drink healthy drinks, healthy hot drinks throughout the day, like just plain simple hot water or lukewarm water or some type of kadha or some concoction, such warm fluids might help, and it is soothing to throat. So those who already have cough and cold issues, those who already have throat congestion, chest congestion, they can go ahead with warm fluids, which would definitely help them. For people with diabetes, I would suggest warm fluids such as warm soups, homemade vegetable soups, which will also give them some vegetables, fibers, as well as warmth of those liquids. So it will also help them keep full and also maintain their sugar levels.
All right. Thank you. And this is again important input that as per our own immunity or our own health status right now, we can decide whether we need hot water or we don't need. So, Tejas, one more important question that I'm sure every person who is diabetic he is having in his mind is. Can we say that being a diabetic, I have increased risk of having this infection or getting affected by corona? How far do you feel ki this kind of thoughts are right, and I mean how it should affect me as an individual?
Yeah. So basically, people with diabetes are afraid because they read in newspapers, on news channels, they watch
Yes.
that people with
Yes.
diabetes are dying because of corona. And the truth is that people with diabetes are not more likely to catch corona. Their possibility of getting infected with corona is similar to others. But if a person with diabetes gets corona infection, then there are chances that that person will see or face the complications of corona, it is more likely for that person than other people without diabetes. So if you are diabetic, you have to take appropriate care because you are likely to have complications of corona if you are infected with corona by chance.
Okay, okay. Understood. So in short, we need to take care, like, for diabetic people, already we say, कि just take care that, make sure that you will not have any infection because of increased sugar level. There are chances कि वो थोड़ा aggravate हो जाए, right? So same thing, I think we can continue telling them right now.
It has also been seen that those people who are controlling their diabetes well are not likely to have those
Yes,
complications.
yes, that's what I was going to come to the next point, that if our viewers or if the person who has diabetes, they're checking their blood sugar levels regularly, and if they know that it is at the normal level, then they might not need to think negatively कि I have increased risk, right? So again, since we are discussing about this checking sugar level, so how do you suggest how frequently person should check his sugar level? I mean, if he's, if the person has diabetes since last 7, 8 years, then how often he should check his sugar levels?
And I would like to comment here that in India, the awareness regarding checking blood sugar levels is very poor. People check their sugar level just once in a month, and that too fasting and PP, and they report those sugars to their doctors. And before they do so, previous day they manage their diet and exercise so well that their sugar levels are still very nice in the graph. But to be very frank, you have to keep your sugar levels in good range 24 by 7. So more you check, more you will come to know where are you going wrong. And that is why we recommend that at least you should check your sugar levels 7 times in a week. That's the bare minimum requirement. And many people are not
Okay.
doing it. So I would suggest people to do it. And 7 times in a week has a particular format or it has some system behind it. Like 7 times random sugar is not required. But out of those 7 times sugars, we usually suggest two sugars in the morning, like pre and post breakfast. One day you can skip, on second day or third day you can check your pre and post lunch. Again, fourth or fifth day you can skip, and on sixth, seventh day you can check your pre and post dinner. So different times of the day you are checking sugars in pairs. So you come to know what is your sugar at that particular time of the day and how food is affecting your sugar level. So checking these 6 sugars and one random sugar if you feel uncomfortable any point of the time, or if you are exercising, you must know what is happening with your sugar. So one random based on different circumstances or possibilities, and 6 different pairs. So 3 pairs, total 6 sugars. 7 sugars per week.
Right. I think this is again important. Like if we are using glucometer at home, that is pretty much possible. And
Yes.
during this lockdown, I mean, as we are recommended, as we are asked to stay home, we cannot go out in the laboratories. But yes, we can use our glucometers and keep a track on our sugar levels. And as Tejas has mentioned, we should check it 7 times in a week, means at least once a day. So I'm sure our patients and our listeners are going to practice this, because prevention is better than cure. So if we know that sugar is increasing because of this particular food, we can take care. So in between, before I go to next question, I would like to tell my viewers and all the attendees here that if you want to ask any question, live question, you can raise your hand if you are on Zoom meeting. So we will give you access to speak to our expert and you can ask your question live. At the same time, if you are listening to us on Facebook, you can type your questions on this comment box, and our team will convey these questions to us, and we will try to cover all the questions as much as possible. Right. So we will go ahead with the next question, Tejas. So one viewer is asking us, we have already started getting so many questions. Oh my God. So one person is asking us, what should be the diet for diabetes? So I know it is a very vast question, but still, if you can give us a little bit idea about how a diabetic person's diet should look like.
Yes. So I would like to say that diet for person with diabetes is good for everyone in the family. So it shouldn't be prepared separately that this is the diet for person with diabetes and this is the diet for others in the family. So I think a healthy, well-balanced diet is good for any person and a person with diabetes. And diabetic people should keep in their mind that more they eat refined foods like maida, potato, rice. So such foods are going to increase their sugar levels very rapidly. So better stay away from such refined foods where there are no fibers at all. Refined foods are foods without any fiber. And
Yes.
against this, you have to take more amount of fiber in the diet, and fibers are present in foods like all fruits, vegetables, grains with cover, pulses with cover, sprouts, seeds with cover. So, for example, flax seeds. Flax seeds we eat with cover. So, wherever you
Yes.
can have things with cover, those foods are going to give you a lot of fiber, and fibers will be keeping your sugar levels in good range. So your diet should be rich in fibers and low in refined food or starchy foods. Second point is your diet has to have some good amount of protein because many of us lack proteins in the diet, and proteins are again they don't increase your sugar levels to the extent that carbohydrates do.
Okay.
Carbohydrates they increase your sugar level very rapidly. So rice, chapati, bhakri, all these are carbohydrates. They are going to increase your sugar anyhow. So better include some proteins in every meal. So every of your meals should contain some proteins in the form of either dals or curds or sprouts, as I said, or you can have paneer or you can have some small portion of cheese. So some proteins in every meal. If you can visualize your meal, many times we only have chapati and sabji as our meal. But
Right.
chapati and sabji is not a complete meal. It lacks protein. So you have to have some proteins in every meal. Also make sure that you have some raw food with every meal. Chapati sabzi is a cooked food. So there are less amount of fibers. If you can have some raw food in the form of salads or in the form of some raita, then it's going to give you more amount of fibers, more amount of micronutrients also. More you cook the food, you lose nutrients. So better if you can have, minimally cooked foods or raw foods for that matter, if you can chew well or if you have no other health issues. Then yes, having raw food and proteins with every meal is a key. And don't binge on food. Some people have that mindset that they, keep on eating every 2 hours, every 3 hours, thinking that their sugar levels will be in steady range.
Okay.
Sometimes they feel very hungry. And if you are feeling hungry very soon, even after eating a good meal, then you again must check your sugar levels because high sugar levels also make you hungry. You have to
Yes.
make sure that whether you are hungry because you are really hungry or because of high sugar levels. And then you have to work on your hunger. Whether you are really hungry, then you have to, introspect and see what, where are you going wrong in your previous meal. So your previous meal should be rich in fibers and protein, so you won't feel full very soon. And there should be at least a gap of 4 hours, I would say, for a person with diabetes, so that sugar levels will not be very high after eating foods.
Okay, perfect. I think this is a very important input what you have given, Tejas, and I'm sure all of us are going to implement that. Include fiber, include protein in each meal. So, Tejas, we have one attendee here, one listener here, Tejal Deshpande. She wants to talk to us and ask her questions. So, Tejal, I am going to allow you to talk. You can ask your question. Now you are able to ask your question. 8 seconds just. So I have unmuted you from my side. You need to unmute yourself and then you can talk to us. You can ask your question.
Hello.
Yes, ma'am. We can
Yeah,
hear you.
yeah.
Ask your.
Thank you, doctor, for your great help about diet. I just want to ask you one thing is that My dad is taking the pills of a diabetes, and
Okay.
it's of uh, glyclazide 80 mg and metformin hydrochloride 500 mg tablets. Uh, he he's taking that tablets, and he also has very good diet, like he maintains diet of ragi, like taking ragi bhakri. He does not eat any sweets. Due to that, it happened to him that his sugar level were fall very drastically, and he was feeling like very unconscious kind of a thing. So in this lockdown period, how we can handle with all these such things, and we can know that okay, this is just because of his levels are down or up, getting up. So how we can understand that all things?
Okay. I'm not able to hear you properly, but I assume that you're asking that your dad's sugar levels are going down in between.
Yes,
Am
so Tejas, what she said, I will just brief you in short. She said that his father is trying to have all the healthy food, like, having ragi and like he's trying to cope up with the diet. And after that, his sugar levels are dropping down. Okay. So now how we can keep a check on this dropping down sugar, or what foods she can include in current situation?
Yeah. So Tejal, what I would like to suggest you, do you have a meter with you, glucometer with you? Do you check sugars at home?
No, actually the thing is that we don't know how to operate, and many such people are unguided us that it's not working for us, like it gives a wrong reading and that all things, so we didn't buy it.
So I would like to elaborate more on having a glucometer, and especially when you cannot visit laboratories, when you cannot visit doctors, it is very important tool for diabetes management because see, there is a basic difference between glucometer checkup and your venous blood checkup. So whenever you give blood in the lab, how do you give it? Through your vein, right? They take out your blood with a syringe from your vein on your arm, right? And while checking blood sugar at home, you prick your finger and you prick your capillaries in the finger and then check blood from that. So there is basic difference in the measurement of these two. And there will be difference in the sugar levels checked by these two different methods. So you have to accept that there will be some difference between your lab readings
Yes.
and glucometer readings, and that's absolutely acceptable. So there are some norms for it, like 10 to 15% of difference plus or minus with the lab value is absolutely okay. And glucometer gives you very accurate results as far as your capillary blood is concerned, and it helps you quite a lot, especially when your sugars are dropping down. So, if your father is anticipating that he has low sugar levels, or you all are anticipating he is unconscious sometimes, so you must check his sugar levels at that particular time. So, you will know whether it is because of sugar or whether it is because of some other reason. If whenever he is feeling unconscious or uncomfortable, if his sugar levels are low at that time, then I would suggest that you need not modify his diet as such, but you can talk to your doctor and then modify the dose of his medicines, because medicines are dropping down his sugar levels, not the diet. Diet cannot make his sugars low, right? Medicines are getting sugars down. So better you speak to the doctor on phone or through any virtual media, and then you can adjust the dose of the medications if required, if the medications are getting down his sugar levels to a very low level. And with his diet, whenever he is having hypo, that is called hypo, when sugars are going below 70, that is called hypoglycemia. And whenever your diet is facing hypoglycemia, at that particular time, we suggest you to give him 15 grams of simple carbohydrates, like 15 grams of sugar or 15 grams of glucose powder if his sugar level is below 70. So his sugar levels will be in the range in next 10 to 15 minutes, and then he should have something uh, filling so that his sugars won't drop again. But I must tell you that treating hypo is very important. If you treat it on time, he will not be unconscious. Very low sugar levels are the reason of unconsciousness. So make sure his sugar levels are not dropping to the drastic level. Talk to your doctor, get the dose adjusted, and keep on checking sugar, especially at different time points of the day, as I suggested, 8 times or 7 times in the week, so that you will know when exactly he is facing hypo and you will be able to prevent it.
Absolutely. Thank you so much for your inputs, Tejas. Tejal, I would also like to inform you and our all the listeners that Just for Hearts has a vast experience in helping people who are diabetic. Like since last 2 years, we have almost helped over 50,000 people with our telephonic consultation. We have helped them in knowing hypoglycemia or how they can actually settle their hypoglycemia or diet related queries, or if they have some other issues related to blood sugar levels. So definitely, I think in that case, I think talking to an expert will also help them, right, Tejas? Do you also recommend that?
Yes.
Talking to the expert in this situation, you already mentioned that talk to doctor and the expert to know and to learn using glucometer and to manage your diet. Perfect. So I would like to go ahead with next question. So we have Mr. Deepak Kanojia. He is asking us that, Madam, machine which is there at home, it doesn't give exact report. I mean, there is a difference than the glucometer report and lab report. And daily going to lab is not possible. So what do you suggest?
So I think I've already answered this question. There
You
is
mentioned this. Yes.
Yeah, there is some difference in lab values and glucometer values, which is acceptable. And with that also, you can go ahead and predict your sugar levels, because, as I said, 10% of difference is acceptable. So lab, if your lab report shows 200 as your sugar, your glucometer is likely to show your sugar in between 180 and 220. That is absolutely fine. So if your sugar is
Okay.
300, glucometer is going to show you sugar between 270 and 330, which is high. Both of them are high.
Right.
You have to
True.
treat what is shown by your glucometer, and it is very reliable tool for home monitoring. When you cannot go in the lab, lab testing is also expensive. So comparatively, glucometer checking is also affordable, and at home you can do it at different points of the time of the day. Like in the lab, you cannot go in the middle of the night if you have any problem. But at the same
Yes.
time, if you face any problem at home in the middle of the night, if you face hypo, if you feel uncomfortable at night, you can directly have your sugar readings on your hand with your glucometer.
Yes.
That's the ease, and that's the comfort with the glucometer which you can have in diabetes management. And accept some difference. There will be some difference. So don't blame glucometer that it's not showing accurate results. It is showing accurate results for the blood you have given it to, capillary blood. But for venous bloods, yes, there is some difference and you have to accept it. There is no other way to it. And also make sure
Right.
that,
Similar way, I think.
yes, you have to calibrate your glucometer regularly. So in this long period, I think it's not possible, but at least once in a year or once in 6 months, you have to calibrate your glucometer. You can contact the company person for that. The person comes, tests your glucometer with the sample solution they have, and they will tell you whether your glucometer is working fine or it has some extra error which it shouldn't show, and then they will repair it and give you back. So calibrating it is also very important.
That is a very important point, Tejas. Thank you so much for putting in that. If you are using, first thing we need to use glucometer. Okay. Second thing, if we are using glucometer, we need to calibrate also that. And how you will do that? Then you have to contact the manufacturer or the company person who from where you have bought this. Okay. So I request all my patients and all the viewers that this is a very important point. Please check your sugar levels every day, and after this lockdown, whenever it is possible, do calibrate your glucometers also. So Tejas, this discussion is really interesting, and we have so many listeners and so many questions coming in. So we have one more question directly from you and our follower is asking us, he is Milind Kulkarni, he is saying that can a diabetic person eat khajur or dates in limited quantity or he needs to avoid it completely? What are your comments?
So, dates are like sugar. Sugar,
Yes.
jaggery, and dates. They have got similar glycemic index. Glycemic index is the number, or the way a food increases your sugar level. So, dates increase your sugar level quite rapidly. And for that, you need not trust me. One day you can have dates and check your sugar levels. So, you will come to know how they are impacting your sugar levels. And for that, you have to check your pre and post sugar level. Like, uh, sugar level before eating dates and sugar level after eating dates, so that you will come to know what exactly is happening with your sugar level. But our experience says that yes, dates increase sugar levels quite a lot. So whenever you are low with your sugar level, at that time you can have dates, I would say. Or whenever, if you are going
Okay.
to exercise. So before exercise, as I was talking, that you have to have a combination of complex carbohydrates and proteins. So in that you can have one date, few black currants, and along with that some nuts like cashew, badam, walnuts. If you have such a combination with proteins, then you can have dates. But having plain dates, having them in high quantity like 5-6 dates at a time is not going to help. It will increase your sugar level. Or having date syrup with some other foods
Yes.
is not recommended. But whenever you are low or whenever you are going to exercise at that point of time, 1 or 2 days, I would say kharik is better. Kharik you can have one kharik per day can be taken with before exercise. But avoid dates as far as possible as a regular food or food to be taken in high quantity.
Okay. Okay. So, as Tejas has mentioned, that we can say instead of dates, we can go for dried dates. That is kharik. We call it as kharik in Marathi or chuhara in Hindi. So we can have dried dates before our workout because before our exercise we need some energy and we need some simple carbohydrates. So dried dates and this is what I think is called lifestyle modification कि हमें जो पसंद है उसके खाने के आप कैसे ways ढूंढते हो. That is very important. So what we learn here is कि अगर आपको dates खाने हैं तो आपको थोड़ा सा exercise भी करना पड़ेगा, है ना? So you can give that leverage to yourself to enjoy your favorite food.
Right.
So I would like to go to next question now, Tejas. I would like to know that a person is saying that does sugar levels affect sleep routine also? Like at what age any person can get sugar if it is genetically carried from your parents or or from the ancestors or if your brother or sister they have. So
So
am
I will,
I clear or shall I
yeah, please repeat it. If I'm correct, you are
still
asking
repeat?
a person with family history of diabetes when he will develop diabetes in future. Is it the question?
Yes, he asked two questions. So this is the first question. I think we would like to listen to this.
So I would like to comment on this that even if you have a family history of diabetes, which is we call a non-modifiable risk factor for diabetes, it is not that you will develop diabetes certainly in your future. You can prevent diabetes despite that you have family history of diabetes with a good lifestyle. So there are different things you should consider that keep exercising regularly, keep your weight under control, keep your diet as healthy diet as possible. Also have your stress under control, and if you can manage your lifestyle well, even if you have got family history of diabetes, you can prevent diabetes. But if you have family history of diabetes and at the same time you have or you carry other modifiable risk factors of diabetes like obesity, like inactivity, then you are likely to get it very soon. And it is seen that people develop diabetes some years earlier than their parents. Like, for example, if parents develop diabetes in their 50s, it is likely that in the next generation will develop diabetes in their 40s if they don't take appropriate care. But if they take appropriate
Okay.
care, if they keep their lifestyle healthy, then they can prevent it altogether. That's the good news.
Okay, great. So we have one more viewer. He is Money S, and they are saying that they have already attended Tejas' previous session, which we did last week. So they are saying that you mentioned about for diabetes management, you mentioned about Panchasutri. So can you just explain that once again? Okay, what this Panchasutri is and what exactly we need to do with that?
Yes. That is very popular Panchasutri. We explain to our patients in KM hospital, and we have also made
Okay.
different flex and different posters for it. So that Panchasutri says that there are 5 different aspects of diabetes management, and those 5 aspects you have to consider at the same time. Like only one aspect won't help you. You have to control all those 5 aspects to manage your diabetes well. And first of all, first aspect of it is your diet. So you have to have balanced, good diet for keeping your diabetes under control. Second aspect is your
Okay.
exercise or activity levels. You have to exercise regularly. Third aspect is keep your stress levels under control, stress management. Fourth aspect is your medications. Whatever medicines your doctor has prescribed, you have to take them on time as prescribed in the due amount and without any your own judgments and your own experiments. And fifth important point is monitoring. So monitoring your sugar levels on time as suggested, monitoring your blood parameters annually, like your checkup for your kidney, checkup for your heart, checkups for your eyes, checkups for your nerves. There are different tests a diabetic person is recommended to undergo every year to make sure that diabetes has not affected any other organs in the body. So those tests has to be performed on time and interpreted and action should be taken on. So these are the 5 aspects: diet, exercise, stress management, medicines, and regular checkup.
Wow, that's really nice, and it's very easy to keep it in mind. Like, I have seen that being a diabetic, we always have that stress in the mind कि अब तो मुझे, I mean, I have to take medicine, I'm a diabetic. But instead of thinking negative about it, these are 5 things which we can focus, which we can follow, so that we can definitely have a better and healthy life. So, Tejas, we would like to go to next question. And Mr. Vishal Bhoi, they are asking us that can you suggest some exercises which we can do during this lockdown period? So it is for diabetic people also, but I'm sure it will be implemented or applicable for non-diabetics. So
As far
what
as
exercises?
concern for people with diabetes, I would suggest that first you need to talk to your doctor. I mean, if you already know the situation, that's fine. But you must know that if you already have some other comorbidities of diabetes, like if you already have high blood pressure, if you already have some problem with your joints like knees and back, then you must take into consideration your doctor's advice before performing any type of exercise. Along with that, as I suggested, you have to make sure that your sugar levels are in the good range before you exercise. So we usually say that your sugar level should be above 100 and below 250 when you are exercising. So make sure that your sugar levels are in the good range. And if you take care of these 2 points, then any type of exercise is okay. But we usually recommend a combination of different types of exercises. Like we usually perform aerobic or cardio type of exercises. So we go for a walk or we have, go for swimming, we go for cycling. These all are types of exercises which are called cardio exercises. But along with this, if you could incorporate some weight training exercise, and weight training need not be in the gym. You need not go to the gym always whenever we are talking about weight training. You can simply perform them at home with your own weight. Then you have to lift your own weight and exercises such as squats, lunges, push-ups, pull-ups, planks. There are different types of home-based workouts wherein you lift your own weight, own body weight, and perform different exercises.
Okay.
If you have a set of dumbbells at your home, you can perform n number of different exercises with dumbbells, like 2 kg dumbbells or 5 kg dumbbells. You can buy based on your own capacity and experience in this field. But yes, even you can perform various weight training exercises with water bottles. Like if you have 1 liter water bottle at your home, have two bottles, just fill in water in them and use them as dumbbells and have different kind of exercises with 1 liter bottle in each hand. So there are different weight training aspects you can perform at home along with some cardio exercise. So you can have walks on your terrace or in the balcony or in the room or in the hall, in the kitchen, where anywhere in the home you can have walk. Having a walk is
Yes.
not a problem anywhere. You can skip if you, I mean, skipping is a good exercise. So if you can have good sport shoes with you, then I would sport shoes, then perform these activities because these are called impact giving activities, and better if you can have soft sole shoes for that and can have your skipping workouts later. So even
Right.
yoga workouts like uh, Surya Namaskar, simple, which you can perform at home uh, without any assistance. Simple workout, Surya Namaskar. It is a very good workout and gives exercise to whole of your body. And those who cannot
Yes.
perform Surya Namaskar or those who have any restrictions on movements, they can also perform chair Surya Namaskar. Like Surya Namaskar sitting on the chair. There is a simpler version of it. So all these points can be considered while we are talking about exercise during this lockdown period.
Yes, that's a great and vast input. And yes, exercise makes a lot of difference in managing sugar and overall lifestyle. So, considering this only, Just for Hearts has already started with live yoga sessions. And I'm sure many of our viewers are following us. And we go live on Instagram page on every Wednesday, Thursday, 4 o'clock. And every Friday, we have some or the other activity which is related to fitness. So Friday session is by 5 to 6, and Wednesday, Thursday, Insta live session, specifically yoga live session will be 4 o'clock. So 4 to 4:30, you can definitely join us for our live yoga session. Now we have one more question from Mr. Deepak Kanonjia. So he is saying that is it mandatory to stop rice completely once you know that you are a diabetic person?
Yes, very common question. And rice is very popular and favorite food of all, including me. So we never want to give up with it. And yes, it is not that the good news is not, it is not that you have to skip or stop rice completely. But there is a
Right.
big after that. And that what is you have to know the type of rice you are eating. So if you are eating polished rice
Yes.
or white rice, it is certainly going to increase your sugar level. As I was talking before, that you have to have grains with cover, and cover has fibers. So if you can have grains with cover, those fibers will help you keep your sugar levels under control. So instead of having white rice, if you could have brown rice or unpolished rice, that will help you keeping your sugar levels under control. But at the same time, I suggest people with diabetes that if you are going to eat brown rice in your meal, then restrict on other sources of carbohydrates. Like don't eat rice and chapati together, or don't eat rice and bhakri together. One day enjoy your rice, just brown rice with other accompaniments like with dal, with sabzi, with curd. So with other protein, fiber sources, have your brown rice. Then don't have chapati and bhakri with it. If one day you are going to have chapati, have only chapati. Don't, have rice accompanying it. So restrict the number of carbohydrate exchanges you are having in your food. And whenever you are having rice, remember that usually we have that practice that we have rice in bigger quantity, larger quantity, and dal in smaller quantity. So that's again where we go wrong. So whenever you are eating rice, make sure that you have double the amount of dal. So if it is just one katori of brown rice, have 2 katori of dal, and I would say dal also if you could have with cover, like we get chilka dal. Chilka dal is moong dal with cover. So if you could have that with rice, then you can really enjoy your rice without any fear in mind, and it won't increase your sugar level if you have it in limited amount and with good amount of protein and other fiber sources.
I'm sorry. Absolutely, Tejas. People are actually enjoying these answers and they have more and more questions related to diabetes. So, before I will move ahead for further questions, we will be taking more one or two questions because we already have time restrictions. So, I would like to tell our listeners that Tejas will be going live on coming Tuesday. So, every Tuesday, she comes live on YouTube with Just for Hearts. So you can again connect with her and ask your questions, not only related to diet, but we have various topics and various discussions happening. So definitely this is not the last chance for you. We are trying to take as much as possible the questions and comments in here. So one more question, Tejas, that Deepak ji is saying that sugar level, is it possible that sugar level also changes as per the climatic changes? Because he has seen that as per the climate, he has seen some changes in his sugar levels or I think related symptoms, we can say.
Yes. So it is generally observed that people with diabetes experience more hypoglycemia in summers. So when the temperature goes high, the prevalence of hypoglycemia or the possibility of hypoglycemia, it goes up. So make sure that your sugar levels are good in the summer, they don't go down too much. And in winters and in rainy season, the hypoglycemia risk is comparatively low. But if it is because of temperature or climate, if it is because of other factors, then you cannot predict it. But yes, hypos are
Yes.
seen more in summer. And the answer is that you have to keep on checking sugars. And if
Sugar
needed,
level.
adjust the dose of medicine. If you are already hypo, treat it with 15 grams of sugar and just make sure that it doesn't happen again if it is happening because of other factors than climate. And always keep something handy. So right now you cannot go out, but if in summers, if you want to go out somewhere, then always keep something handy which you can easily keep with you. And if you experience symptoms of hypo anywhere in between, in the middle of something, you can just put that in your mouth and you can treat your hypo. And some such options are either, as I said, dates or dry dates you can keep with you. Or there are some glucose tablets available in the market, glucovita tablets they are called. So if you can have some tablets with you, glucovita tablets, glucose tablets with you, you can easily pop up 3 or 4 tablets and you can save yourself from hypo. You can treat hypo wherever you are if you are going in very hot temperature, hot weather outside.
All right. So last question, Tejas. Already we are running out of time, but still this is the most famous question. And in last discussion, I remember we had covered this about fasting and diabetes. So the viewer or our follower is asking that can diabetic person do a fasting? So how healthy it is, or we have intermittent fasting and so many fancy things are coming up.
So, to answer your question, I would start with people with diabetes who are not on any medicine. Many people with diabetes, they manage their diabetes well just with lifestyle modification or just with following different lifestyle tips. If you are one of them or if you are a pre-diabetic, then yes, a fast would certainly help you, and intermittent fasting is a good way to reduce some weight, to have good insulin sensitivity and all. If you are already a person with diabetes and on medications, then fasting can be a little dangerous if you already have taken your medicines and if you are fasting. Then it is likely that the medicines are going to work on your food And if you don't take food, then your sugar levels will drop down and you will experience hypo. So having a fast with diabetes and with medications of diabetes is still possible if you can consult your doctor and nutritionists and adjust your medicines for your fast. Like for example, a person wants to fast for Navratri for
Yes.
9 days. And if for that 9 days period, if he talks to his doctor and nutritionist and gets his medicines adjusted for that time period, then with new medicine schedule, you can still fast, but for that you need expert guidance and thorough consultation, thorough knowledge of your fast and what exactly is your fast about. Otherwise, what I would suggest for people with diabetes, rather than fasting, having a healthy diet is more important for everyone, including people with diabetes. So first, make sure that you improve on your diet first. Then think about fasting. If fasting is for religious purpose,
Yes.
then yes, for 1 or 2 days it's fine. But again, make sure that you check your sugar levels more frequently during your fast, so you will come to know whether your sugar levels are in the range. If they are not in the range, you can have good amount of foods which are in quotes allowed for fasting. And many people have seen that on fasting days it becomes other way around. Like we fear for hypos during fasting. So many people eat a lot of sabudana khichdi, potato on
Yes.
fasting days, and their sugar levels spike like anything on fasting days. So both we need to avoid. That's called roller and coaster of sugar levels. So very high sugar levels and very low sugar levels, both are harmful. So if you are fasting, make sure that you don't overeat. And if you are really fasting, then make sure that you get your medicine adjusted in consultation with your doctor. And what you are going to eat on fasting days, that you have to consult your nutritionist and get it checked, get it very well planned, and then you can go ahead with fast.
Absolutely. Thank you so much, Tejas. And as Tejas has also insisted that you can consult with the doctor or nutritionist, and that has a different impact on your. See, various times we feel we know we have that information, but when it comes from the person who is going to monitor it for you, that really helps you in managing the blood sugar levels, or when it comes to weight loss and managing your weight loss. So we also have expert health coaches, diabetes coaches on panel, and you can also connect with them, connect with us, and have a one-to-one consultation. If you're interested and you're listening to us on Facebook, you can leave your contact details on the comment box or to our inbox, and we will get in touch with you and we will help you further in your diabetes management. So for today, we will end the session here. We have already exceeded the time, and I would really like to say thank you to Tejas. Thank you so much for all the important inputs, and this is really going to help our and let's stay tuned, and we will see you all again on Tuesday with our new session and new week. So thank you so much and see you all again.
Thank you, Divya. It was nice talking to you and interact with our viewers. Thank you so much.
Before we sign off, a small request to all the members who have joined us on Zoom, that you can give your feedback about the session, and I will release this poll wherein you can tell us how did you like this session. It was good, very good and excellent. And if you're on Facebook, please type whatever your feedback is there on the comment box. We love seeing your feedbacks, and it really motivates us to connect with you and come again with a new topic. So we have started getting feedback, and people are really excited, and I will just end this poll. So everybody really liked the session, and they're saying it was excellent session. So with this note, we end this session, and thank you so much, Tejas, once again. And thank you. Thank you all.